Welcome back to another episode of the Pharmacist Diaries podcast. This is a series of episodes I am bringing you for World Antimicrobial Resistance Awareness Week. You have heard already from multiple pharmacists, a patient journey, but you'll also be hearing from a doctor as well. I'm really excited today because I have an amazing pharmacist with us who has had an incredible journey in a Band 6 hospital job, working her way through a specialist antimicrobial pharmacist job, and she is now working as a specialist antimicrobial pharmacist at Oxford University Hospitals NHS Trust. Most of you who listen or watch these episodes know how much love I have for Oxford because I started my journey there as a resident pharmacist, and I'm so excited to bring you Bee Yean Ng. And I'm really excited about sharing her story, the journey that she's had with research, and also a lot of the courage and confidence she's gained along the way. Let's invite her to this week's episode. Hey, Bee.
Hello. Thank you very much for having me.
Absolutely. I'm really excited to have you here, and I can't wait to share your story and your journey as a pharmacist. But let me take you back to when you originally applied to become a pharmacist and what pharmacy school was like for you. Can you share a little bit about your journey from then?
Yes. I wish I would have some very inspiring and exciting story to share with you, but I don't have one. So I think back on when I'm back in Malaysia, when I finished my Form 6, which is equivalent to A-level here, what I did is I kind of look at the subject I'm interested in and then the options available. And that's how kind of I choose pharmacy as my kind of undergrad, and I did a 2+2 program with University of Strathclyde. So, and after I graduate, I got a training pharmacist post in independent community pharmacy in London. So that's kind of how it is. But what I would say is, if I were to go back and choose again, I would become a pharmacist again. So that's all I can say.
Awesome. Yeah. Well, that's good to hear, isn't it?
Yeah.
You're quite far into your journey now. And I'm glad that you love it so much. Take me back to when you were a pharmacy student, when you were learning everything from clinical conditions, consultation skills, pharmaceutics, looking at organic chemistry, biology. What were the things that you were passionate about then? And also tell us, what were your thoughts on what your career journey would look like?
When I was a student, I'm really interested in the clinical perspective and also the consultations as well. So to be honest, at the time, I'm not sure whether I want to go into community or hospital. And I think at the time, that's kind of the two sector that's in my mind. And in my mind, I think if I choose one, I'll stay to become a community pharmacist or a hospital pharmacist for the rest of my life. So that's what I was thinking throughout kind of my uni life, obviously. But it's happened that way, but slightly different.
Yeah, awesome. And what was community pharmacy like when you did your training year? Did you fall in love with it? Were you really passionate about the journey? Or did you feel like me, where you wanted to explore other things that pharmacy had to offer as well?
I really, really enjoy my community training year. So I have an excellent tutor, Roger, for 4-way pharmacy. So he is amazing. He's been so supportive throughout the year, and I have learned so much from him. And it is from him that I've learned that to become a good pharmacist is about what you do in your daily job, and it's not about the sector that you're in. So I think he teach me a lot throughout the year. And because he know that I'm not sure which sector I want to go into, so he also really supportive of me to apply for and arrange a hospital placement, which I did. And I quite like the clinical perspective through the placement, which is what led me to kind of switch path. But overall, I really enjoy my community time and my training years.
Awesome. And I love that you bring a positive spin to it. I mean, if we're realistic, a lot of people have slightly negative comments about community pharmacy, maybe because they feel like they're not as clinical in the job and they want to do a lot more kind of clinical impact for the patient. But also it's such a busy environment. You might be lacking resources. You might be the only pharmacist there. There's limited information when it comes to clinically screening prescriptions. I absolutely loved it, but I know for me that there wasn't enough variety in the day-to-day work, which is why I wanted to explore other avenues. But I really liked the independent pharmacy. I think that was one thing that made me really excited about it, because the owner really wanted to focus on a lot of the services that we provide. And I think community pharmacy is definitely evolving, but I just love that you put a positive spin on it and you really enjoyed working with your mentor and your tutor. And it helps you to understand that whatever you do in your day-to-day job, like, do the best version of what you can with the resource that you've got. Was it hard to apply for a hospital post coming from a community background? Because this is also something that a lot of young people find quite challenging, because they feel like they don't necessarily have the impact that a hospital training pharmacist or a pre-reg pharmacist would be able to deliver in terms of the interview. Was that something that was a struggle for you?
I think yes, in a way. Obviously, because of the experience-wise in comparisons to trainee pharmacists who've done their training years in hospital. But I think using the kind of experience from the placements is putting into interview is kind of help. But I have to say, I have to apply for quite a few hospital to get only get an interview for a few, and then obviously I got offered to get a post here. So it's not impossible, but I do think that you do need to put the effort in to kind of understand at least what it took and what is the job entails.
Awesome. And obviously you moved around as well. Like you studied university, then you moved to London, and then you actually moved out to the countryside to Buckinghamshire, which can be quite hard. It's not like you've got lots of family here. This is not like your original home. Was that something that played a part into how you felt about living in the country and exposing yourself to all these different things?
I think there's a pro and cons in a way to it, because all my family is kind of back home in Malaysia, so I kind of doesn't have the tie of like which part of the country I can be. So it kind of give me the flexibility of like go where the opportunity is and go where the job is. So that's one part of it. Obviously, the other part is my family is not here, so I'll miss them, like, occasionally. I mean, sorry, Mom, very much.
Yeah, you're right. It is quite hard though.
Yes.
I mean, I've lived abroad, and I think, I was married, so Sanjay became my family. But you do obviously miss, parents, grandparents, like cousins, things like that. And especially having lived in the UK, where a lot of my family are, it's quite challenging to expose yourself to a new place, new culture. Even the work environment's completely different, expectations are different. It's quite a challenge, but it's nice to see how positive your mindset is. And I think that's genuinely who you are. You do put a lot of positivity into any situation, and you might not realize that you're doing it, but it's something that I've noticed about you as well. And it's clearly coming across on the podcast episode today as well. What was it like transitioning then into a hospital role and rotating through different areas? You would have done your diploma at that time. What were the things that you really fell in love with during that kind of foundation years?
I think making the transition is not easy. I think I just want to be honest. And for the first probably 6 months, I'm still kind of trying to figure out like what is not relevant when I review a patient, and kind of how to prioritize patients when I kind of doing a ward. So there is this kind of like at least 6 months of transitions periods from a community background. And my lead at the time was Kate Russell-Hobbs. She's and my tutor at the time is Claire Brandish. So I've been telling that to everyone. They say no, but I think they are the one who taught me how to become a clinical pharmacist. So I think after the 6 months, you kind of get used to the environment and also the kind of how things work. And I think that's then I start to kind of really enjoy the variety that hospital offer. And because you can rotate every 3 months, and you kind of can see a lot of kind of different specialty and how it works. So which is what I really, really enjoy.
What were the things that you fell in love with? Which rotations did you love the best? And also just dive into, and this is something I talk about a lot, is that I'm someone who likes kind of the medical side of conditions rather than surgery. I'm not the biggest fan of kind of doing a surgical ward, and I'm quite open about that. And I also love that I have a role where I just visit patients as and when needed as part of my job versus covering, a 40-bedded unit. So what were the things about pharmacy and the rotations and what you were exposed to that you genuinely fell in love with? What did you learn about yourself?
Well, I learned that maybe how indecisive I was in a way to find what I love. So I've done all the rotations that's available within the hospital as a Band 6, and I love all of them. It's even if there are specialty that I know I don't want to specialize in. I'll give some example like medicine informations and hematology oncology. I know I don't want to specialize in, but I really truly enjoy the rotation as well. So this gives me kind of like a headache in a way that is like, so what would I want to specialize in? I enjoy so much, like I enjoy medicine, I enjoy surgery, I enjoy like spinal units, all of them I really like, and pediatric as well. So when a jobs come out at Claire teams for antimicrobial pharmacists, I was like, you know what, I'll give it a go. And I tried it. And I think that's how I kind of find my thing, because for antimicrobial stewardship is specialist, but it's also generalist. So it's cover all perspective. Every specialty, almost every specialty, use antimicrobial in a different way. So you kind of touch on everything, but you're also wearing a specialist hat as well. So I think that's kind of how I found my love in antimicrobial stewardship, and also how I found my specialty.
It's also quite exciting because you worked with two really inspiring pharmacists and two pharmacists who absolutely love what they do. They found their passion, and it's like they're all in, and you know that that's what they're going to do for the rest of their career. And being exposed to that as part of like the Stoke Mandeville family is really important. And it's valuable to also think about like the people that you're surrounded by, the people that support you, mentor you, etc. Those are the ones that kind of help you make decisions in your career journey. So it's really good that you kind of stepped into it knowing that you've got this support network and a mini pharmacy family to work alongside you. But you're also leveling up. You're turning from a Band 6 who is rotational, kind of does what's expected of them, is growing from a clinical perspective, gathering all those skills that you need as a foundation. You're doing your diploma, etc. But then when you step into a Band 7 position and you have to have a little bit more of that challenge, a little bit more expertise, and also specifically in antimicrobials, the ward rounds are already established within those roles. So you're not actually just on a ward, you're moving around to different places. Tell us a little bit about your journey from that shift from a Band 6 position stepping into a Band 7.
I think I'm very lucky in the way that, like you say, have a very good, line manager. Obviously, Claire Brandish will be like my line manager at the time, and also surrounded by very good kind of peer support. So obviously stepping into the job, and kind of Claire have think about a proper training package for me, and for her it's like she's kind of like really good in kind of like taking me to kind of all the rounds first, and then let me see how it's done, and then make sure that I'm confident enough before kind of like obviously I go to do the round myself or review a guideline myself, etc. So I do feel that it's like yes, you go into the role, you're not expected to know everything, and you know that there is a support there. I think that's kind of eased myself a bit, and also the fact that knowing that Claire, because she's my tutor from like since I'm a junior pharmacist, knowing her also kind of like give me the kind of confidence to ask the question as well. If like I don't have to kind of like say like, oh God, I don't know anything, what do I do? And I just ask her, and then she will point me out to like resources and stuff to look at. Yeah.
It's valuable that you share that, because a lot of people think that when they transition from a junior post to a more specialist post, that you should already have experience in that area. As an antimicrobial pharmacist, you obviously get exposed to antibiotics on a daily basis, no matter where you work. There are going to be infections everywhere. So you've got the basic information. Even as a trainee pharmacist or being newly qualified, you have to understand the different groups of antibiotics that exist, what doses there are, interactions. You're having to look at levels for specific drugs like vancomycin, gentamicin. So you've got some baseline knowledge. But when you step into a specialist position, you obviously have to be able to give your expertise. And you are kind of put on the spot a lot of the time because they're expecting you to be able to support. And that can be quite challenging. Was there anything specific that you did to learn or to become more confident in understanding the different microbes and how you link them to the different drug treatments and what options that we have?
There's a lot of resources out there, like for like kind of like e-learning and packagings, etc. So I think what I really find the most useful is learning at the job. And if I see a patient, for example, I tend to kind of like discuss with my senior or also like the microbiologist or infectious diseases doctor, because sometimes the thing about antimicrobial stewardship is there's no one answer. Sometimes that you can have more than one answer. It's just what's your thought around it, and also kind of how you kind of like put in place this kind of safety net and kind of monitoring around it. So I think there is a lot of like resources out there, like that you can do some basic kind of like background learning, and you can just Google it. Like there's some BSAC learning material, and I think HGE also got some packages as well. But I think it's how to apply it to kind of your daily practice, and I think it's by doing the walk rounds and by discussing the patients with actually different, like with doctors, with with other pharmacists. That's kind of how I learned. And today, I've still learned a lot through the walk rounds and the individual cases that I see.
I mean, that's kind of the most exciting part of the role, I think, because every patient is completely different. They don't necessarily fit into a guideline. And you have to individualize the care depending on what you get with your blood results and your cultures and things like that, the sensitivities. I also think that one of the best things about working in antimicrobials is that the doctors and the microbiologists that we work with absolutely love pharmacy, and it makes such a massive difference. Like being in pediatrics was a complete game changer when it came to multidisciplinary working for me personally. The joy that I got and the value and the kind of appreciation from their point of view to have a pharmacist on board was something that helped me to realize that this is the space I want to be in. These are the people, these are my tribe. These are the people who I want to work with. Because when I worked in Oxford as a resident and had to go on ward rounds as a junior pharmacist, it was a really scary experience. Some of the adult consultants are scary people. And even when they were quizzing their junior doctors, like you would be fearful as to whether or not they can answer the question, because they really have such high expectations, but they also like just fire things at you and expect you to answer on the spot, when sometimes for me, I need to think a little bit. I need to take a step back, look at the bigger picture. I might need to look up resources and kind of discuss it with a colleague or something like that. And I think that when I work with pediatric consultants, when I've worked in antimicrobials, it's much more collaborative. It's more like a discussion. And that's so valuable when you're trying to learn, especially when you're new to the field. And having come in as a locum at this point and working with Claire, I've been really fortunate that I'm not a specialist in this area, and I haven't worked in adults in nearly 6 years. So of course, like going into the MDT, I'm out of my comfort zone a little bit. I'm having to look up drug doses. Like cafidoricol, I genuinely did not know what the adult dose was, and everyone was just staring at me like, you should know this answer. But then deep down, I'm like, it's okay. You're not expected to know everything. Part of the journey when you step into new places, new environments, is that you know where to look things up, and you just have to take your time. I don't know if you've been exposed to that sort of sensation and how it makes you feel.
I totally agree. I think no one would be expected to know everything in the world. And I think, like you say, that micro ID consultants, they all of them that I work with at least like very pharmacy friendly. And when they ask a question, they generally just want to know the answer and want to have a discussions. And when you say like, you know what, I need to go back and look into it and then I'll get back to you, they was like, yeah, sure, get back to me. Like, so I think having kind of that thought and knowing that like is I think is really help. And I think that is also to bear in mind that it's like, I think all of us have a common goal. We want the best for the patients, and including the patients, him or herself as well. So we might come from different kind of perspective, like, but ultimately we will want the best for the patients and will come up with a holistic plan that everyone executes. So I think that's the beauty of the discussions, to come up with a consensus that what's work best for the patients. And I think that's also the beauty of antimicrobial stewardship work round.
You're loving what you're doing.
I do.
I love it.
I do them.
It makes me happy to see that you're happy. I also wanted to ask you what other things that you got involved with as a Band 7 pharmacist within Claire's team.
Mm-hmm.
So I know that, I mean, knowing what I see in the job day to day now, there are so many guidelines. I am just so shocked that this many guidelines include antibiotics, and it is a constant effort to update them, review them, look at, resistance patterns. What are we going to do for our patients? So was that something that must have been quite new to you after being in a Band 6 position to have to step up and actually review guidelines, keep them updated? And were there other projects that you got involved with as well?
I think reviewing guidelines definitely kind of changes from 6 and 7. And for the first guidelines I review, certainly it can be a bit nerve-wracking, like i.e. where you look for stuff and how detailed you look into stuff and what do you include and what do you exclude. So I think for my first guideline, Claire really helped me to kind of like make sure that I pitch it at kind of like the way that's like the stewardship groups kind of like want. And also the fact that it's like she I remember she told me one thing, because I asked her like, what if I got things wrong? What if I put wrong things on the guideline? She said like, all these guidelines need to be endorsed. All these guidelines need to go through antimicrobial stewardship group, and you will have second pair of eyes obviously checking you, but I wouldn't expect you to put wrong things as well. You need to do your own check, but again, this guideline will get endorsed. So I think that's kind of like give me another layer kind of like of ease, knowing that there is due process in reviewing a guidelines. And there is a general principle when you review a guidelines, like it could be for surgery, it can be for medicines, where you look for stuff, how you look for stuff. And this general principle is actually translatable and applicable to all guideline review.
It is quite hard though compared to other specialist areas, because you've got national guidance, which I'm not saying you copy and paste it, but you generally are following national guidelines like NICE. And it's easy, like with hypertension, it's kind of easy to make that transition. But when you're looking at antibiotics, the complexities is you're looking at the local population and what the resistance patterns are. I think also I've seen that there's a lot of international evidence that we're using when it comes to antimicrobials. And there are medications that they use in the US that we would kind of never really use here or have access to, or it's not on our formulary. And sometimes those switches or that kind of thought process you have with guideline development is a little bit different to other areas that I've worked in so far. And I have also found that with antimicrobials that we are collaborating with other local hospitals like Oxford. We look at Reading as well, and we're all kind of collaborating as part of the same group so that we're sharing ideas, sharing what's worked, but we also individualize our guidelines. So there was a few kind of cases of Clostridium difficile, and they were related to two drugs like clindamycin and flucloxacillin being used together. And because there was a few cases within the hospital, we're now questioning, hey, do we use those drugs together with our own patient cohort, or do we follow the national guidance and kind of see where it goes? So it's different, but it's also the same. The concepts still apply, but you also have to use a little bit more kind of experience and expertise. But it's really great to work with Claire because she's just a knowledge machine. and
agree
you
more.
can you can literally just sit next to her and you're stuck with something, and it's just like it just flows out of her mouth, and you're just like, how do you even know all of this stuff?
Yeah.
But she just knows so much, and it's just wonderful to be able to work with someone who is that incredibly experienced and inspiring in the journey. And I'm 14 years into my journey, and it's still incredibly inspiring to work with her.
I totally agree. Like Claire Brandish, Kate Russell-Hobbs, and Dr. Louis Dunshmill, antimicrobial stewardship consultant pharmacist at Oxford. Like every time I work with them, they kind of like throw me some kind of like good idea and I learn something new every time. So I totally go with you.
So tell us a little bit about the projects that you worked with from a global point of view, and you also got involved with a fellowship. So tell us about that journey.
So around, I think, 2019, there is the Commonwealth Partnership for Antimicrobial Stewardship grant, which I have the opportunity to kind of join. It's a partnership between Nottingham Trent University and Makerere University at Uganda. From the Buckinghamshire side, Claire and Kate is spearheading that. So I think I'm really lucky to have the opportunity to have this really eye-opening experience. So the aim of the project is to enhance antimicrobial stewardships in Wakiso district in Uganda. So what we did is we flew over to Uganda. Claire, the first trip is Claire and myself to do a kind of a scoping visit to kind of understand the local context. And then what we did as part of the project is we designed training material to train the healthcare professional who then use the train-the-trainer approach to train the community health worker within the Wakiso district area to deliver messages and kind of like promotion about antimicrobial stewardship and resistant message to the community. And I'm just really, really inspired by what the community health worker is doing for their community, and also the teams within the partnerships that I work with. So I think that's kind of essentially what the project is about. And then going alongside that is the fellowship as well. So running alongside the project is the Chief Pharmaceutical Officer for Global Health Fellowships, which we can apply for. And Claire, Kate, and myself applied for it and got it. So part of the fellowship is they kind of teach you basic principle about global health, project management, and kind of leadership skill, which we then apply to our project. And each of us have to kind of still also do lead on some objective. And our objective is to evaluate the impact of fellowships, of the global health fellowships on pharmacist leaderships, and if there's any benefit to NHS. So I think that's another kind of new experience for me, because that's the first time I learned how to do a qualitative data analysis. And I'm really, really happy as well that all our work obviously led to a publications. Again, a new experience for me. So I think through the partnership and through the fellowships, it's kind of opened up a lot of opportunities. I mean, certainly for myself.
I love that. And it was such an exciting time. And what an opportunity to be able to travel abroad and use your experience, your expertise, and your knowledge to help another country and another district in terms of antimicrobial stewardship. But it wasn't just about you helping them. The partnership is both ways, right? And it's so exciting that they must have given a lot of knowledge and shared a lot of their experiences with you. How do you feel having done that, and kind of how did it impact your pharmacy journey?
I think having this exposure is really, really helpful. And I think totally bi-directional learning. Like I've learned a lot from them and throughout the whole journey. I never have any experience of publications before that. And then they have, because they're led by a university, and they got a lot of experience in kind of writing out manuscript and data analysis, etc. So I learned awful lot from them from that perspective. And I think it's also sparked my interest in kind of global health and also kind of international projects. And it's really, really relevant because antimicrobial resistant organisms they don't have a passport and they don't recognize border. So it's a global issue, and it's really, really crucial that we all work together globally to tackle these issues.
Yeah, awesome. And I think you've done a 360 because obviously now you're in a specialist like antimicrobial stewardship role in Oxford, and you've stepped up from a 7 to an 8A position, which is incredible. And it's just so nice to have seen that journey. And I was so excited when I heard that news as well. But that journey has also led to some incredible things as well. So when you're thinking about you were part of the fellowship and part of this like international partnership, I believe now that you're actually the lead for kind of that project and that partnership in Oxford, how does that feel to switch from just being involved to actually leading it in exchange?
Yeah. So when I moved to Oxford and when the CWPAMS 2 grants come out, I have a chat with my line manager, Dr. Louise Dunschmill, and she's really, really supportive of us applying for the CWPAMS 2 grant. And she knows a micro ID consultant, Dr. Monique Anderson, who have a link with Kilifi County Referral Hospital at Kenya. So that's kind of how we kind of get in touch and set up the partnerships. So we apply for it. And obviously before that, we need to decide who will be the lead UK partner. And I was quite antsy, and I was like, Lou, do you mind lead? And Monique, do you mind lead? And I think Louise and Monique, they really, really encouraged me and then to kind of lead the project, which eventually I did. And I have learned so much from it, like throughout the 1.5 years, because I think it's not just about like being a member, you kind of like obviously discuss the strategy and the activities and implement it. And I think from the lead perspective, there's a lot of other things to look into, like the finance and making sure that like all the activities fit in and make sure that the goalpost is met and the deadline is met, all the reporting is done, and all those kind of things has to be in place. And as the lead, that's what you need to make sure is happen. And I'm very lucky to have a very good lead from the Kilifi side, Dr. Nadia Allianz, who's kind of like the powerhouse that push things to make sure things just happen. So I think it's a very good experience, and I really, really enjoy it.
Amazing. And part of your journey, obviously, working in Oxford now, you told us that doing this global work sparked your interest in terms of research and getting published. And you've been involved with something that's called the SPARK study. So maybe you can tell us about that?
Yes. So the SPACE study is a 2 years NIHR research study. So for all of us that work in antimicrobial stewardship and infectious diseases, we know the implications of having a penicillin allergy label. So, I mean, when you read the study, the statistic might be different, but there's around 6 to 10% of UK populations carrying a penicillin allergy label. And it's likely that around maybe just 10% of them are truly allergic to penicillins. But having the label have a lot of implications because you might have a higher risk of getting a hospital-acquired infections. You have higher risk of getting resistant organisms. And you also have a 50% higher chance to get a surgical site infections. So there's a lot of implications of having the label. And back on 2021, when the SPACE studies happened, there's just not a lot of center that they label what we call a spurious, which is uncertain penicillin allergy. So the objective of the SPACE study is to test the feasibility of a non-allergy specialist-led penicillin allergy delabeling service. So it's a multi-center study by Oxford, Birmingham, and Leeds. So Oxford and Birmingham is led by pharmacists, and then Leeds is led by nurse. So myself and my other colleagues, Cornelia, is the research pharmacist at Oxford, where we implement the penicillin allergy delabeling service.
And how has that impacted your career journey? Are there any specific skills that you've utilized that are different to being a ward-based pharmacist or working within a multidisciplinary team that you could share with us in terms of the research?
I think the experience of setting up the whole service is one thing. And also the fact that it's doing the risk assessments, consenting the patients, counseling the patients about the benefit of joining the space study, and utilize my independent prescribing because I'm the person who prescribed. Obviously, my colleagues and myself will split the role. But we are ultimately responsible for the prescribing, the administrations, and the monitoring of the patients, and obviously removing the label once everything is successful. So I think that's kind of really, really useful and give me kind of another perspective when I speak to kind of doctor to encourage them to delabel patients. Because I think sometimes you talk to the doctors and you say do you mind delabel? But having the understanding of doing it yourself to kind of give me a confidence to say yes, this is the low risk patients. You can delabel the patients. So all of the patients that low risk within that we recruit, we delabel successfully. So I think this is kind of give me the confidence in kind of advising penicillin allergy delabeling. And I think the other aspect as well of the space study is there is a second work stream where they interview the participants to see how they kind of feel about the service and what do they think having the label is. And the outcome of that work stream is that patients have a lot of the patients doesn't really know much about the implications of having the penicillin allergy label. So this means that we still have a lot of work to do to raise awareness, not just about penicillin allergy label, but in general about antimicrobial resistance with public. And I think this is also quite nicely highlighted in the new 5-year UK AMR action plans to kind of raise public awareness and knowledge on antimicrobial resistance.
Checking allergies is just part and parcel of our job, right? We do it day in, day out. But I'm still surprised as to how many patients that I see with the words penicillin allergy. But when you dive into the details or the background or the information from the family members or carers or the patient themselves, you start uncovering information that seems a little bit unclear.
Yes.
And even in my journey with Claire, in the space of a few months, we have been working hard to understand which patients do have a true penicillin allergy versus those that don't. We've been actually looking into delabeling them, prescribing them a stat dose of amoxicillin. A lot of them are on ICU. And it's been really valuable because there's also the communication that then goes to the patient. So they carry around something in their wallet, or they can take a picture of the letter that says that they don't have a penicillin allergy, but also the communication that goes back to the GP to update their SCR records and things like that. So it's been really interesting to see that, because in pediatrics, we don't see that many penicillin allergies. I would say that I don't have that much exposure to it in comparison to the adult space, but I'm seeing it more and more often. So as a pharmacist who's on any ward, it's really important to get those allergies written out, get the details of them, the history of them. And if it's unclear, we need to focus a little bit more on understanding the patient journey. And even if they're not on antibiotics in that moment, well, when you're not on the ward and it's nighttime and we don't have a clear picture as to what's happening, the wrong antibiotics could be chosen, or we're making resistance patterns even worse by having inaccurate information on the chart. So that's something that's really important to share as from a pharmacist point of view. And it's so exciting that you got involved with this study, Bee. I'm so happy for you.
Yes, it's come around kind of I'm really lucky to have the opportunity as well. So I'm really glad.
Yeah, it's super rewarding to get involved with something that's happening also on a regional scale as well, because that gives you a larger network of pharmacists and other healthcare professionals that you work with. Like you said, you build a lot of confidence in terms of that leadership journey. You're utilizing different skills that you would traditionally use on in a clinical role within a ward or, a clinic or in dispensary. So it's just nice that you've kind of expanded your horizons. And global health is now obviously something that you're really passionate about, and you're doing further education. Am I right?
Yes. I'm self-funded doing a master in global health at UCL. I just started probably 2 months. So yeah.
And what was your motivation to apply for it?
I think having been involved in the Uganda and Kenya project, I think that's kind of, like I say, sparked my interest in global health. And kind of when I started to think, actually, what do I want to do with my life? I think this been in my kind of thought process for a while, and I was thinking if I don't do it now, when would I do it? And then I think with leading the OXAM's Oxford and Kilifi Strengthened Antimicrobial Stewardship, that's what we call our partnerships projects, is kind of consolidate that idea that I want to learn more about global health. So, and then which is how I decide to kind of go for it. Obviously, I have a chat with Lou, my line manager, first, and she's so supportive of me doing it. So I think, so that's one thing led to another. Yeah.
Pharmacists, we never stop learning, do we?
So true.
It's never ending.
So
my
true.
family members as well, they're always like, when are you going to stop doing postgraduate education? Is there going to be a point? And when I was working, it's just like you continually want to improve because things are evolving all the time within our roles. And actually that education brings in a lot of the knowledge that we need to then implement service improvements or get involved with research, or like you're doing. It's not just the work that you're doing within the NHS. You're thinking, how is this going to help me on a national, if not a global scale? And I love that you've gotten involved with so many different things in your journey, because it's helped you to figure out what your passions exactly are, and trying new things and going outside your comfort zone, like coming onto the podcast today is another thing you can tick off your list as something that's really enjoyable that has helped you on your journey, which is so cool. How has the first 2 months of the course been? What have you sort of learned so far, and what are you looking forward to?
I've learned a lot, actually. I think it's a steep learning curve, I have to say. There's a lot that I need to kind of learn, because it's not the course. A lot of them is about looking at the system as a whole, and looking at sometimes the policy and the health system from kind of different countries. So it's not clinical in a way. Yes, there is some bits, but not not pure clinical. So I think I really enjoy that perspective in a way, because I think it's throwing a different mix. And I think sometimes as pharmacists, we feel like we need to come up with an answer or a plan in the end. But I think for global health, sometimes you probably doesn't have to necessarily come up with an answer, but you need to make sure you consider all aspects. So I think that's kind of give me a kind of different mindset and kind of different consideration as well. So I think I'm learning a lot, kind of different perspective and more kind of wider picture as well.
Well, it's really good, because a lot of the things that you're probably learning on the course aren't necessarily things that you can learn in the job, or it takes a long time to kind of gain that information. And you'll come out of the course, hopefully, with lots of inspiration, kind of ideas, projects, and a lot more confidence in terms of leadership as well. So that's really exciting. I mean, you've come so far, Bee. And I love your story and the passion behind your love for antimicrobials. And I just want to say a massive thank you, because you not only have, taken the day off today, you've travelled on the bus to come from Oxford to here to spend some time with us. And it's just so good to see you again after many years. But it's also just amazing to see how far you've come. And I'm really proud of you. And I'm really excited that you've found something that you genuinely love and that you're passionate about. And, I wish you all the best in the future as well.
Thank you. And I just want to say thanks to all the peers and mentors that I have throughout my career, because I think without them kind of encourage me and push me out of my comfort zone, I think knowing myself, I probably wouldn't do a lot of the things and wouldn't take on a lot of opportunity. Like, I mean, Lou recently just pushed me, not the right word, encouraged me to take on, apply for a role at British Infection Associations. So for those who are interested in infectious diseases and AMS, I do encourage you to sign up. There's a free membership. But I think that's kind of another aspect that I never thought I would do without the encouragement. So I think I'm really grateful to all the peers and the mentor and line manager that I have throughout my career, and yourself as well. This isn't, again, outside my comfort zone. I just want to say, like, I'm a bit of out of my body experience at the moment, but thank you to everyone who's not saying it out. Like,
yeah, awesome. Love it. Thank you.
Thank you very much. Thank you, everyone.